my name is Tramika Newton, and I'm with Herzing University. I'm in the F&P program, and again, this is my patient, Miss Natasha Wilson, that has volunteered her time, and we want to thank her again. We have to redo parts of the video due to editing, not being able to upload the videos and things of that nature. So I want to make sure that I covered everything that was required for this assessment. I'm going to assess Mrs. Wilson's maxillary sinuses for any pain or tenderness. Any pain?
No.
And her frontal sinuses. Any pain?
No.
Okay. So no pain or tenderness noted to her sinuses. We're also going to redo a portion of her spinal exam. I'm gonna have you step down for me. Or hop down. Okay. We're gonna get Miss Wilson to bend forward with flexion. Okay, come back up. We're gonna have you extend as far back as you can. Good. Come back up. We're gonna bend to the right. And I'm noticing the curvature. Okay, that little C, and bend to the left. Let's see. Okay, come back up. And we're gonna do lateral rotations all the way around. Hip all the way around, both sides. One more time. Okay, so she has complete full range of motion of her spinal cord. And we talked about previously on the last video, assessing her spinal processes. So again, we're gonna kind of go all the way down on the spinal cord, and we're noting any pain or tenderness. Any pain?
No.
Okay, and then you also want to kind of palpate on outside the perisinuses. Any pain?
No.
Okay, I'm gonna have you sit back up here for me. In a cardiac exam, we auscultated and we palpated her carotid arteries, the temporal arteries. We're gonna now do the radial arteries, which I know I did it with the vital signs. Your ulnar pulses. They're strong and regular, not thready or brachial. And we also covered in a previous video a posterior dorsalis pedis and her posterior tibialis. So the only one we didn't include in the other video that was cut out was her popliteal. Okay, pulses. So all of her pulses are +2. We've been looking at her skin and assessing throughout the whole video. Everything is warm, dry, and symmetrical. In the last video, we covered all of her triceps, all of her bicep reflexes that were intact. And I think that concludes everything on the physical exam. And again, I just want to thank the patient for her time. Oh, I'm sorry, one more thing we needed to do. I'm gonna have you lie down for me. We did a complete abdominal examination on a previous video, and we were able to feel the tip of her liver, but we did not check for jugular vein distension, nor did we check for hepatojugular regurgitation. So I'm gonna get the patient to look to the left. So she has no jugular vein distension noted. And again, we're going to palpate for the liver with deep palpation. Keep your head turned to the left, Miss Natasha, for me. And I'm going to press in and see if we see any distension with her jugular vein. Deep breath. Exhale. And she's at a 30-degree angle and there's no jugular vein distension. You can relax. Now you can sit up for me. And that concludes our video. Thank you so much.